As scientists continue to research ways to treat coronavirus, blood donations from people who have recovered have become a key piece of the puzzle. But FDA rules from over 3 decades ago still place restrictions on donations from gay and bisexual men, even if they have recovered from COVID-19 and could help others by donating.
When I was sick, it was a debilitating time. I honestly was sleeping for 20 hours per day for something like 8 days straight. And I know that I'm lucky to have survived it because to date I have 7 friends who died from COVID-19. So the moment that I recovered, I knew that I had the antibodies in my system, and I know enough about medicine and research from complete layman's terms that the antibodies in my system could be used to help people who were severely struggling with the virus.
You know, I'd been used to feeling angry about this policy that seems to apply to all blood donation in the US. So honestly, you know, I was angrier about it 10 years ago, and my reaction, you know, today or this year was more just resignation. This still hasn't changed. This is ridiculous.
The FDA restrictions date back to 1985, when the HIV epidemic was ravaging gay communities throughout the US. The guidelines prohibited blood donations from men who had sex with other men even once since 1977.
I think it's important to recognize that the ban really is rooted in discriminatory attitudes and based on fear and not science. That fear was very real in the early days of the HIV epidemic.
Restrictions weren't altered until 2015, when the lifetime ban on donations became a 12-month ban. This was lowered to 3 months of abstinence in 2020, during the initial rapid spread of coronavirus in the US.
3 months doesn't really make a lot of sense. At the end of the day, the real risk factors for having undetected HIV are things like condomless sex and having multiple sex partners. Being gay doesn't automatically mean that you have those risk factors. As the policy stands right now, a heterosexual man could have sex with 100 different women in the past month and never use condoms, and he would be allowed to donate blood. Whereas a gay man who's married, who only has sex with his partner and always uses condoms, he can't donate blood. Even though that first person is at a way higher risk of having undetected HIV, that would make its way into the blood supply.
Some activists say that even this new policy upholds, quote, discriminatory practices based on outdated stereotypes.
It's completely hypocritical to ask gay, bi, queer men to abstain from sex in order to donate blood. It doesn't make sense to me. Maybe during the AIDS crisis, when we didn't know what was happening, when our doctors were still trying to figure out what is AIDS, who gets AIDS, is it the gay cancer as they were calling it back then?
You can't really justify it logically because there's this gaping flaw. And the fact that, you know, why don't you ask straight people about their sexual history more carefully?
Health experts also point out that antibody tests can detect HIV from 3 to 12 weeks after having contracted the virus. And advocates argue that wide access to HIV testing bolsters the argument against the 90-day waiting period.
Many hold the opinion, myself included, that the ban is based in stigma. It's not based in science. In 2020, we have made huge strides in the progress to fight the HIV epidemic, and these kinds of blanket bans don't take any of those advancements into account. I think the shortening of the deferral period is a step in the right direction, but I don't think it goes far enough.
It's sad that the FDA needed a horrible pandemic and a blood shortage to revisit this homophobic guidance that affects the blood supply and also affects the mental health of gay and bisexual men across the country. But I hope now that they're paying more attention to it, that they'll take that next step and get rid of a ban on gay and bisexual men.